So, Doc, you had 4 different breathwork practices here. Do you want to just quickly go through each of those?
Beautiful. And some of these too, when we get into the application and as a hot sec, we'll get into some more of these a little bit more in depth. So one is diaphragmatic breathing. And actually, this might be a perfect time to, if you want to show people the difference between diaphragmatic breathing and chest breathing.
Yeah.
And then we can get
We just do
some of the
both?
others. Yeah,
Just do
let's
both?
do it.
Okay.
Cool.
So, we'll start with diaphragmatic breathing. Now, applications for this, in my opinion, would be patients who have tight stomach from more anxiety-based issues.
Holding everything.
Yep. Tend to have a more poor posture. They want to also try to influence the vagal tone as best as they can. And it's just a quick way to start practicing your breath, I think.
Yeah, get your mind and body
I think so.
connected.
It is. Yeah, I think so. So this is where you'll have one hand on your chest, one hand on your stomach. You can lie down or sit doing this. Now what you're going to do is you're going to inhale through the nose, but your goal is to have your hand move on your stomach out, but your hand on your chest, try to keep still. Don't let your breath move your hand on your chest. So we're trying to influence our stomach breathing using expanding our diaphragm and out. And now some diaphragmatic practice users, they breathe out through pursed lips. So you'll breathe in through the nose like this, and then breathe out
Like you're blowing through a straw.
like you're blowing, yep, like you're blowing through a straw. And this helps you to slow your exhale. Again, increase the vagal tone. You want a long exhale if we're trying to improve the vagal tone. So breath in again through the nose.
And out as you're breathing through.
Out pursed lips. Your hand on your belly should be moving in and out when you breathe. So do that. I would repeat that 10 to 15, 20 times. Great way to start practicing the breath.
Yeah.
The extended exhale, I'm going to switch this. The double inhale, exhale, extended exhale is probably a little bit more effective. So that's where you're going to breathe in as much as you can.
Yep.
And then quick double inhale. Focus on exhaling as long as you can. So you'll breathe in again, in, double inhale.
Even if you get a third or fourth inhale at the top.
For sure.
As much as you can.
Get as much of an inhale as you can. You're trying to recruit as much of those alveolar sacs as possible. Most humans only use 60% of their lung capacity because of just how shallow breathers we are.
Wow.
It's bad. So that is one way to really drive more usage of our alveoli using that kind of practice.
And Doc, let's get into, because the Botako technique and box breathing will work into this, but let's get into the torso. So the thing that you learned from Greg Rose that we talked about previously, let's add that into here so you can see with the diaphragmatic breathing versus chest breathing.
I love that. So one way you can practice, we'll call it rib expansion if we have a lack of rotation either in our lumbar spine or mostly in our thoracic spine. A lot of people don't know they have this issue. Now, if you're a golfer or if you require a lot of rotation with your job, you'll notice, if you've noticed that you haven't had a good ability to either turn one way or the other, maybe you have a lot of restriction in this area, what have you. There's a very quick way that you can assess to see if you should practice this. And a lot of people need to.
I was blown away.
Yeah, like some people need this more than others, but a lot of you don't breathe very well and probably have a decreased rotation in your thoracic spine. And just this breathing practice alone can improve that. And so that's what I was working on Doc with. So the assessment first, we need to get down on our stomach, and we're only looking at how to influence the thoracic spine rib cage area here.
Mid-back,
So one way we're gonna assess that is we're gonna get down on our knees like this. And we're gonna try to curl over and lock out our lumbar spine. And we're doing that because we're only trying to assess rotation up here. So we're gonna lock it out.
Kind of like child's pose, right?
In a way, yeah, like child's pose. One arm behind your back, and we're gonna try to bring your chest parallel to a wall near you, and you're gonna try to open it up as much as you can. Now you should have about, some people can get to full, like a straight line 180 degrees up and down between this arm and this arm.
Both sides.
Both sides.
Yep.
So again,
It almost forces you to breathe or hold the breath in through the rib cage
Yes.
lungs as you're trying to rotate.
yes. Now, when we were working with Doc, one of his sides, he could get perfect up and down 180-degree angle with both of his sides. Or with one of his sides, excuse me.
Yep.
The other side, we had about 10 to 20 degrees to go. And so we did this breathing practice to try to increase rib expansion
Okay.
and improve his range of motion, which we absolutely got to. So this is the practice now. You can do this lying down or you can do this seated. It's probably more effective to do it lying down. So what we're going to do, we're going to focus 5 breaths on the lower part of the rib cage and 5 breaths on the upper part of the rib cage. We talked about the bucket handle and we talked about the pump handle. Down here is the bucket handle. We want to think of expanding our rib cage out this way with the bucket handle.
Laterally outwards.
Yes.
Yep.
So you're going to put your hands down here. You're going to take a breath in. Think of expanding those hands out. Breathe in through the nose, out through the nose.
Okay, we're doing this 5
And then,
times,
yep,
right?
so that was 5 for me.
Okay.
Now you're going to think putting your fist right on your sternum. And now this is going to come up and down like a pump handle. So when you breathe, think of moving your chest up, your hand up and down. That's the motion we're going to try to get to. One more. Good. Now we're going to get back to assessment state. And you're going to revisit how much rotation that you have. So you're going to lock out the spine, curl all the way up, and I can already tell I have probably about 5 to 10% improved motion on that side.
It's even better than it was prior for me too.
Perfect. Now that's just one very simple way to explain how breath work can improve a lot more than just what we're talking about. So rib expansion, even if you've had a cough recently and you've just had a lot of tightness in the chest, tightness in the back.
Yes.
These are all applications to where you'd want to assess that for yourself and then maybe improve it using the exercise. That's a quick one to throw in with patients too. That's what's cool.
That's like Doc, yeah, thank you for going through that too. Because you were saying even individuals where it's even hard to get into a child's pose, and then let's say they're not even able to put their hand behind their back.
Then you'll notice just how bad your scapular thoracic rhythm is, how bad you have. A lot of people too think that their shoulder issue is their shoulder, but that's another piece people miss is poor thoracic spine rotation and mobility.
Yes.
And we have a patient with shoulder pain. You have yet to figure out. You've tried everything. It's maybe not coming from the neck. Now you're like, all right, if it's not the neck, what else could it be? Do that test assessment, and they have shoulder pain, and they're not even able to do that.
Where would you start if an individual can't bring their hand behind their back?
Then we've already got to that point. It's breath work time.
Breath work.
See what we can do to expand that rib cage. You go back to that, and now they can at least put it behind their back.
And then get into rotation.
You knew it wasn't really their shoulder. It was, or there was a piece missing.
Yes.
Could have shoulder issues, but a big part of that also came from the fact they didn't have good thoracic mobility.
So you then want to start 5 breaths through the belly.
Yep.
5 breaths through the chest.
Yep.
Build it up multiple times throughout the day, I'm assuming.
Yep, absolutely.
Beautiful.
And then Greg has so many more resources on his website, mytpi.com.
Greg Rose.
Greg Rose. He is the founder of Titleist Performance Institute. He's worked with some of the best, if not all the best, golfers in the world, and proving, obviously, that's a huge part of their life, is making sure that they have good rotation in the thoracic spine. But his ability to not only impact their lives, but everyone else who needs this kind of work. Trust me, everyone. You'd be surprised at how many people just need to do that little assessment on themselves and improve that area of their body. But yeah,
I love that.
Super fun to see that change so quickly, and just shows you the importance of breath work. So
yeah, and then let's go into a couple of these other ones, and then I want Doc to go through the Botako nasal breathing because I love that. And I know we've been through box breathing before, where you create a breath in through the inhalation, hold it for the same amount of time, breathe out through the same amount of time, hold at the end for the same amount of time. So we're creating a box with either inhalation, exhalation, and the holds at the top or bottom, or holding with inhalation or holding out with exhalations. The basics on box breathing usually goes in 4 seconds, where you inhale, hold up top 4 seconds, exhale 4 seconds, hold at the bottom 4 seconds. And you can go through that anywhere from
That's another
5
quick,
to 10 times.
that's another good one. Very quick to practice.
Yep. That can build up 4 seconds, 6 seconds, 8 seconds.
Yep.
It gets more challenging.
I love box breathing too.
Yep.
That's a great one.
Yes. But yeah,
So,
Doc.
yeah, Botako breathing. We're going to go through that. You'll want to sit upright for this one.
Does it matter seated, standing?
It doesn't. You probably could
Okay.
do laying down or standing, but sitting is probably just fine. So what we're going to do, we're going to inhale through our nose 2 to 3 seconds. So we're going to start like that. Exhale 3 to 4 seconds through the nose again. After the exhale, now pinch nose and hold breath.
After the exhale.
Yep.
Okay.
Now, Doc, you keep going. I'm going to coach. You're going to wait until you are hungry for air. I want you to understand that word, hungry for air. So there's an urge to breathe. Okay. Now resume calm nose breathing. Calm nose breathing. Just simple breaths in and out through the nose. Try to gain regulation back to center. And then now you repeat that 5 to 10 times.
Okay.
So you'll find that it does a mixture of two things, right? It's mixing in more of the parasympathetic upregulation with a longer exhale. And we're doing mild hypercapnia, which is increasing CO2 in the body, which just utilizes our oxygen more efficiently as we're kicking it off hemoglobin with the Bohr effect. What are you feeling at all right now, Doc? Anything?
It got easier after the second one.
Okay, sure.
But it was that initial panic where after you exhale and then hold the nose, you can start feeling it. Okay, I want to take a breath. Can you hold it more? Can you hold it more? And then you get a point to where you can't hold it anymore, and then you have to let it out. And then from there, trying to re-regulate everything back to normal breath.
And some of you may not be able to hold it in for 5 seconds, and that's fine. You're just going to keep practicing that. Some of you, after breathing or holding in for so long, you might have this flushing feeling or even a state of maybe some stress or anxiety.
I feel more alert right now, though.
Nice.
Just even 2 sets.
Oh, yeah. I love it. I do. So that is definitely one where I would recommend you guys, maybe more advanced breathers or breathwork trainers, just to give that a try.
Wow. That's good.
The other couple things that I was just going to talk on was the apnea walk and the CO2 tolerance. How about I take apnea walks?
Sure.
You want to talk CO2 tolerance? Okay. So apnea walks, this is where you exhale as long as you can.
Okay.
And then you're going to hold and you're going to walk 10 to 20 steps. Now, I've also seen it where you can go as long as you can, whether that's hold your breath as long as you can or walk as long as you can. Now, what this is going to do is going to build CO2 tolerance again. It's going to talk about mild hypercapnia like we talked about.
Yeah.
But try it on your walk. So when you're walking, you're already there. Just try to exhale out all the air you have, hold, and then do 20 steps and see how you do.
You probably want to hold and pinch off your nose, because if you feel like you're holding exhale
Good
out,
point.
yeah, you might be shallow breathing through your nose. You might not realize it.
Good point.
Yeah. No, I love that.